out. Some people, mm, some people like to listen to it. So determine what type of learner you are, and that'll help too. Get you a whiteboard. What's it called? Concept maps. They are good for you seeing what everything is. Like if you got a disease process, okay, this is what it is. This is what body system it affects. This is what's going on at a cellular level and within the organ system. And this is what it looks like. This is your medical intervention. This is what's going to happen. You need to look out for A, B, and C as the nurse. This is what you monitor. And then this is what you teach your patient. So when you are studying, study to know it. Like I know my address is da 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 da. You know what I'm saying? I know it's certain things that you know. Don't study to pass the test. Study to learn it. So like if you have somebody that you can sit down and kind of like teach back to them, that will get you comfortable and see, okay, I know this because of this, because of this. So yeah. Well, hey y'all, I'm Nursey, a blessed RN, and you caught me on the beginning of just talking about med surg. But this is nursing dosage calculations, a live review and breakdown. I usually do breakdowns on Wednesday nights and Sunday nights and sometimes Saturday mornings. But guess who ain't got to go to work tonight? Me. That's who. So here I am today to kind of fill in with the spaces that I missed. I just got a 90 on my dosage calc test, and you helped me. Yes, awesome! Congratulations! I know you feel so good. I'm so proud of you. Oh my gosh, that's amazing, amazing. So if you guys who are here, let me know what kind of program that you're in: LPN, RN, BSN, accelerated BSN. Um, where were you tuning in from? I'm in Alabama. I'm on Central Time. So if you ever try to catch one of my live sessions, you'll see that it is in Central Time. So come accordingly. Yeah, it's been a wild day, a wild day. I got off this morning and I went to sleep and I got up and like the Vatican has gone crazy, did it done gone crazy, and I'm just like, you know what? Dosage calculations. Oh man, do I review for the T's? No, that'll be future RN prep. That's who you can follow, future RN prep. And then, love, darling, you just passed your exit exam. Okay, congratulations. So preparing for the NCLEX. You see that guy in the comments above? Kevin, Nurse Kevin, he is your guy. He's going to help you with your strategies and your breaking down of the nursing questions, reading the freaking question, as he likes to say. I don't think he says it like that, you know, military folks. They use those other Sunday school words. And then reading the freaking rationales. You're welcome. You're very welcome. All right, so let me go ahead and connect and let's just do a couple of problems this afternoon. I'll come and study with you guys until I have to go with mom again, okay? I hope everybody is doing well within your week. You like Mr. Kevin? I like Mr. Kevin too. He's out here. Well, he calls me the dosage count queen. It says that I'm down here doing the Lord's work, but he is as well. Cause you know, each one teach one. We like giving back to our nursing communities. We thank you guys for your support, and for your recommendations and your referrals. And you know, we just want to see y'all win too. Because I've been in the game 14 years. I think he's been in the game 4 or 5 years. But I'm tired. I need y'all to come on. We short. I'm tired of paper charting. Because that's all I've been doing for the past 2 weeks. My hands hurt. I'm like, come on. All right, so you guys, this is a reconstitution question. And if we need to do some metric conversions, put a one in the chat. Put a one in the comments if you would like to see some metric conversions. Living with Nita, hey, on YouTube. Yes, you did finally catch me live in the daytime. That's why. So it's cool seeing you too. All right. And y'all don't forget to please double tap that screen for me. Send some lives out into the algorithm. Let the nursing students know that we are studying on this Friday afternoon. Okay. So this one says streptomycin 0.25 grams. A vial of streptomycin powder is available with directions to reconstitute with 9 milliliters of sterile water for a concentration of 400 milligrams per 2 milliliters. Calculate the amount to give for one dose. So I'm going to tell you the secret. I'm going to tell you the secret. I'm going to tell you the secret to reconstitution problems. And you will never ever get a reconstitution problem wrong again. Concentrate on the concentration. What do you mean, Nursey? All right, you see this number right here? This is your drug concentration. How many solutes in solvent? So how many of the little pieces of medicine are floating around in your liquid? Okay, so it tells you that you need to add water to it because reconstitution is nothing but making a powder medication into a liquid form so that you can give to your patient, right? So that's all you're doing is making it a medicine. That's what reconstitute is. Big word for add water and shake, okay? So when you add the water and shake, this is what it's going to give you. That is the only thing that you have to use, okay? So concentrate on the concentration. This right here is fluff. Okay. So our goal is to find the amount to give for one dose. So the amount is going to be our milliliters per dose. That's what it's asking us. Okay. So we have 0.25 grams that is in one dose. That's ordered. And then it says we have 400 milligrams of 2 milliliters. Okay, so if I'm looking for milliliter, I always start with what I'm looking for. Living with Nita, you got a 95 on your tablet and oral test. Go ahead, girl. Okay, yes, Miss Ma'am. I love it when y'all guys come on here and report back. Yes. That's what I'm talking about. Let's defeat Dosage all 2024 and beyond. Awesome job. Okay, so all right, I think my little picture's in the way. Okay, so I always start with what it is that I'm looking for. So here we go, 2 milliliters. So I'm going to flip that upside down and I'm going to put my 2 milliliters on top and my milligrams on the bottom. And yes, you can do that because there is the same puzzle piece because we're not doing math. Don't think of it as math because a lot of people say, oh, I can't do math. I'm not good at it. You don't have to. We just solving puzzles, okay? Boom. So we are flipping this puzzle piece to fit our picture how we want it to be. We want it to be milliliters on top and dose on the bottom. So that's why I used this one and I flipped it. And now I got milligrams on the bottom and I need milligrams on the top. So I don't have milligrams right here, do I? I have grams. So I'm going to put in a conversion. I know that 1,000 milligrams equals 1 gram. My milligrams then crosses out. Okay, so now I've got grams on the bottom. I need grams at the top, so I'll use my puzzle piece with grams in it. 0.25 grams is 1 dose. Grams crosses out, and now I have milliliter per dose, and that's it. Now we have our goal, which is what it is that we were looking for. So what I'm going to do is I'm going to enter it into my calculator. I'm going to put all my numbers in on the top and I'm going to hit multiply in between. So 2 times 1,000 times 0.25. Then I'm going to hit divide and I'm going to put all my numbers in on the bottom and I'm going to hit divide in between. So 400 divided by 1 by 1. The ones don't really make a difference, so boom, I'm not going to put that, right? So 2 times 1,000 times 0.25 divided by 400 equals 1.25 milliliters per dose. So if this question asked us to round to the nearest tenths place, what will our answer be? 1.3. Okay. Awesome. Because, right, if remember, round right. So we're rounding to the tenths. We're going to start at the tenths and go one decimal place over. So that number is a 5. So it's a 5 and an up. You round up to the next digit. If it's 4 and below, it stays the same. All right. Let's look at another one. Okay, so drug A, 125 milligrams is to be added to 1 liter of lactated Ringer's IV solution. Available is drug A, 1000 milligrams of in a vial, which to be reconstituted and yields a concentration of 400 milligrams per 3 milliliters. Lord, what was I trying to say? Of how much of drug A will be added to the IV solution. So we're trying to figure out how many milliliters will make 125 milligrams that you need to add to the IV fluid. Okay, so we are going to be looking for milliliters, right? So this is what's ordered. This is fluff because you're just adding it to a bag with 1 liter in there. They're just throwing numbers at this point, okay? And then so it says this is what's available in the vial. Okay, nice to know. But it says when it's reconstituted, it yields a concentration. That's the word we want, okay? So we know we have 400 milligrams per 3 milliliters. And we have ordered 125 milligrams. And I want milliliters, so I'm going to start with my milliliters. I'm going to flip it upside down, 3 mLs over 400 milligrams, okay? I got milligrams on the bottom. I need milligrams at the top. So 125 milligrams over 1, because it's not with anything else. It's single by itself, right? So we'll do 3 times 125 divided by 400. And that equals 0.9375. So if this is going to be rounded to the nearest tenth place, what would our answer be? 0.9. Yep. Are dosage calculations reviewed in an LVN? Yes. An LVN is a licensed vocational nurse. The N in that stands for nurse. So you will be given medicine. So you do need to know how to calculate the math. So yes, absolutely yes. Yes. And it's usually the same in the RN program as it is in the LPN program. It just depends on what your school's curriculum or whatever is. So, and you do need this because right now in this day and time, I am still an RN, an orthopedic nurse, and we are on paper everything. So we are calling the doctors on the telephone and getting verbal orders and writing those down and having to put them in and get them verified, sent them to the pharmacy, put them on the MAR. So you need to know how to do things when you don't have a computer. So I couldn't wait to make that video. I swear I couldn't. I was burning that parking lot up so I can hop in that truck and get on there and tell y'all, yes, you do absolutely freaking need to know how to do this. Because even with the computer does do it for you. Like if you see something that's wrong, because on the other side of that computer is a human. Anybody is prone to make a mistake, and if you're looking at it and you're the one who's giving it and your name is on it and you're going to be in court, then you can't say, well, I didn't know how to do those calculations. The computer did it for me. That ain't gonna hold up. Not gonna hold up at all. I took my first dosage calculation in LVN program Wednesday. I'm not taking this again. Yes. All right, so here's a metric conversion for pounds to kilograms. So we know that 1 kilogram equals 2.2 pounds. So I always start what it is that I'm looking for with what it is that I am looking for. So 1 kg is 2.2 pounds. And then we're going to put our pounds on the top and then cross out with our pounds on the bottom. And so we'll do 260 divided by 2.2, and that is 118.18. If this asks us to round to the nearest whole number, what would our answer be? Maya said true. It is true. It sure the heck is. I couldn't wait because people always ask me that question on the lives, or they'll come in and, comment and say, oh, you don't really need this. I don't see why they have to do this and woo 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 and da 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 da. And I'm just like, well, I did have to do it, and I do look for it, and this and that and the third. But that was a big issue, because there are several hospitals across the U.S. that are dealing with this right now. And it's some scary times, because people don't even know how to paper chart. We have folks over there like about to have a doggone baby, because they're like, oh my gosh, I got a paper chart. I got a paper chart. I got a paper chart. And I'm just like, yeah. People still got to get taken care of, and we got paper. So we just got to write it down and readjust. All right, so 120 milligrams is how many mics? So we know that 1 milligram is 1,000 micrograms, okay? So if we're looking for micrograms, I'm going to start with my micrograms. So it's 1,000 micrograms per 1 milligram. A lot of people try to how do I move or decimal or divide, or how do I know when to multiply? And if your mind works like that, you can say little, large, left, which is going to be 3 decimal spaces to the left, or mite to slight, so a bigger unit to a smaller unit, mite to slight, right, and you'll move it 3 decimal spaces to the right. But if you don't want to learn that, and you just were like, okay, I know that 1 milligram is 1,000 micrograms. I know that 1,000 milligrams is 1 gram. And then I know that 1,000 grams is 1 kilogram. If you set it up like what you're looking for and what you have, and you cross out your units, you'll get it right, every time. So we know that 1,000 mics is 1 milligram. My milligrams are going to go on the top, and then we'll cross that out. When you're doing your dosage calculations, make sure that you write your units out by your numbers, because the units is the important part. If you're doing yourself a great disservice if you're writing your numbers out and then just trying to line it up, and then you get confused and you're like, well, how did I get that wrong? How did I miss this part, or I didn't put that part? The units is the important part. If they are on the top and they are on the bottom and they line up and cross out, and you get what it is that you're looking for, that puzzle piece, that how you get the box on the puzzles, and you want it to look like this. I never forget, I had this Beauty and the Beast puzzle that I could never ever finish. It's probably still to this day as an adult. I'm like, why would you give a little kid this hard puzzle to do? So you're trying to get it to line up to that picture, right? So that's your goal. When you read the question and it asks you for what it is that you're looking for, that's your puzzle picture that you want to get. And so we're going to line these pieces up so that everything fits and crosses out until we get that picture, that Beauty and the Beast picture, right? Don't judge me. That was my little kid obsession. I used to love all things Disney. It just breaks my heart. It's like when you get older and you see what the world is, and how they have all these hidden messages and this and that and the third. It's just crazy. Okay. So, okay, Audacia, you have a good rest of your evening. I'll holler back at you later. Thank you so much for the appreciation and the support. Have a good weekend. Okay, so convert the time to hours and minutes. This is what you need, the skill that you need when you have those IV questions, and we'll do a couple of those in just a minute. When it gives you how long will the infusion complete, and what time, if it starts at 2:00 in the afternoon, what time will it start? So you have to express it in hours and minutes. So when you get your answer in hours, you're going to get the whole number part, which is going to be the hour part. Then everything behind the decimal is going to be your minutes, right? So we know that it's 5 hours, but what is 0.45 in minute time, right? So you'll have to take your number that's behind the decimal, and then you multiply that by 60, because there are 60 minutes in an hour. And then I'll show you skintellectual. Yes. Okay, that's like 3. That's 3 different people now that said 4. They said they've passed some dosage today. I love it. It's a good Friday indeed, man. I was real discouraged getting up and seeing all this craziness in the world. Oh my gosh. Oh, but gosh. Do you post a replay? Yes, Maya. You can go on my YouTube channel. Go on there now. If you have not yet, please. Thank you. I'm on the road to 1,000. But yes, the replays are on my YouTube channel. All of them, mostly all of them, because some of them they get a little janky and get messed up. But for the most part, they're available right after we get done. So if you had a question on there that you want to go back to, they'll be available on the live playlist. Because we have somebody who's on here now. Thank you, Miss Living with Nita. She's on the live on the YouTube side, and I'm on this other part of the TikTok side with y'all. So if you do want to review the replay, it'll be on my YouTube, A Blessed RN. Okay, and then there are other problems that are broken down in the different playlists, like dimensional analysis, desired over half, and ratio proportion. Just in case you don't want to watch the whole replay, but you're looking for how to do a certain type of problem, boom, there you go. All right, so this is 27 minutes. So 5 hours and 27 minutes. Okay, that's how you take care of that. I'm gonna need, okay, thank you. I'm gonna need help with IV rates. Well, let's do some, sis. Or yeah, I hope you sis. It says shy. I don't know. I ain't hating, but I'm just saying that sounds like a woman, but I don't know. You there. How about that? Because I'm not trying to get myself in no hot water, child. Baby. All right. What are we doing? We're doing IV fluorides and drip rates. Okay. Surprise session. Surprise, surprise. Surprise, surprise. Yes, I'm on this Friday because you know I work Friday nights and Thursday nights at the hospital. The rest of the week I'm in my vans. But this weekend we got pageant. Well, not pageant. I always say pageant. We do not have a pageant. We have a recital, dance recital. So I had to do some changing around of my schedule. So here we are. So yeah, hello. How are you? How are you, Miss Jazzy? Thank you so much, Skin Intellectual. I appreciate that. Y'all, oh, I just show up on the FYP. Okay, so then I need y'all who are here to go ahead and double tap on there again so I can be on somebody else's FYP so we can look. I need y'all to come on. Nurses cometh. Okay, nursey get degrees. Let's do it. My daughter has her dance recital next Saturday. Girl, I'm so ready to be done with the end of the school year and dance recital and choir concerts and everything. This mama is done. Like, stick a fork in me, child. All right, order D5W, 500 milliliters to infuse in 12 hours. The drop factor of your tubing is 15 drops per milliliter. How many drops per minute would you infuse? So we want drops on the top and minutes on the bottom. That's what our goal is, okay? So if we are giving it an IV infusion, we know that we need volume. So how much would you give to the patient over how long? That is what's also going to be referred to as your rate, okay? So 500 mLs is to go in over 12 hours, okay? And then our drop factor is 15 drops per milliliter. So I'm going to write my puzzle pieces because it's going to be easy for me to see what I have to work with when I write them on the side versus trying to go through the problem and pick out information. So that's a nice little tidbit that you can, Lord, just popped myself in the eye. That's a nice little tidbit that you can use, like when you're doing your problems. Write your goal at the top so you can see your puzzle picture that's on the box, the Beauty and the Beast picture, right? And then the puzzle pieces on the side. There go Guston and Mrs. Potts right there, right? Okay, so let me stop because baby, I ain't trying to get no Disney coin to take my videos down. But anywho. So we're starting with what we're looking for, which is 15 drops per milliliter. So 15 GTT per ml. All right. So then we've got milliliter on the bottom. We need milliliter on the top, right? So we'll use this. 500 ml over 12 hours. Your milliliters cross out. Remember, I know they don't play about it. That's why I shut up real quick. I'm like, okay, I'm just talking about some French folks. Like, y'all do not have writes over nobody's name like that. But no, you cross out your units. Make sure you write in your units because that's what the important part is, okay? And then 12 hours is at the bottom, but we need minutes at the bottom. We got hours right here, right? So we'll do hour at the top, minute at the bottom. We know that 1 hour is 60 minutes. Your hours then cross out, it is drops per minute. And then the weekend after, she has to perform in the Bahamas. Oh, baby, you can take me with you. I can fit in the luggage now. I don't drop some pounds. I can fold up in there just like this. Just, when I cough or something, just, give me some water. Yes, come on, Bahamas. I need a vacation. As you should, Maya. Don't wait until you get to nursing school. Go over conversion and terminology. Yes. Yes, yes. It's okay to start early. That's not overachieving. You doing what you're supposed to do. You got a goal that's in mind. You know that you want to go to nursing school. Why not research? And while whoever is here, go ahead and follow Night Nurse 305. I think that's her name. Night Nurse 305 on here, Larissa. She's going to give you all the insight and knowledge, and she has a library of like books like that you use for your program. So if you're in the library, you can download the PDFs of the books. She's got myself as a resource listed. Nurse Kevin, he's a strategist. Nurse Glamber, she's a strategist. She know a scholarship lady. I think she said scholarship mama. Oh, hold on. What's her name? College scholarship mama, I think that's what her name is. But anywho, she has her on there, and who else? Future RN Prep. That's for the T's. Yeah. Her name is Night Nurse. Look, we up here trying to get all y'all on. You got a hub of information. That's why it makes me so sad that TikTok has to fight for his life right now. I'm fighting for my life right now. Because honestly, it could be a little controversial, but where else do you know that we can come on, we can study like this, we can come together and give you information? I wish I had this when I was in nursing school. This part, it wasn't bad for me because I was a pharmacy technician, so it was okay. But yeah, like all the other information that she gives is just so valuable. All right, y'all, I got a doorbell ring. Y'all let me know what the answer to this is, because have you ever seen 0.41 of a drop? I'll be right back. No, them shoes ain't gonna get it, boo boo. And look, what's on your pants? No, take that off. Take that off. What about these? What are these? Not that. Those aren't match. It's gold. Well, then you need to change something else. Hurry up, because he waiting on you. Hey, she got to revamp. She changed her shoes. Okay. All right. Appreciate it. Yeah. I don't know what you was finna put on. No, ma'am. No, ma'am, sir, Bob. All right, you guys. Okay. So what did we get? I'm thinking I'm finna come back and y'all got the answer in the comments about what the answer is supposed to be. She said, thank you so much. You're welcome. Okay, thank you, Ashley. I'm glad it's helpful. That's my aim. You know what I'm saying? Like, people like, you just go on live and you tutor too. Yes, I do. But that's the thing. It's just like, who else gonna do it? Because obviously they not teaching it and people be flunking and stuff. Don't nobody got time to be going to nursing school and be paying for programs and not passing because of the math, or not knowing how to break down nursing questions and strategies and stuff. Like, hey, why not be a resource? We got shortage of bedside nurses. You know what I'm saying? Like, you still got people who want to actively go into nursing. I want to help. It is part of my ministry. All right, what's the answer? Because you can't have 10.41 of a drop. What is our answer? We got to round to the nearest whole number. So you tell me, what is our answer? 10. Yes, 10, 10, 10. Okay, so let me tell you why it's 10, okay? So, this is the whole number, and this is the tenths with a TH place, and this is the hundredths, right? So we round it to the nearest tenths place, and the nearest whole number, that's this part, right? So you'll go to one place beyond the decimal. That number is a 4. So if it's 4 and below, this number is going to stay the same. So it's going to be 10 drops per minute. So if it was like 10.51, then it would be up to the next digit, which would be 11. 11. All right, what's this one? Oh, get your freaking dress on. That's a Heparin one. How did that get in there? I was trying to see one with wordy words in it. Wordy words. Okay, interesting. So D5LR, so that's D5 and lactated wrinkles. I don't even know. Is that something? I don't know. At 85 milliliters an hour. An IV pump is not available. Using the pediatric micro drip IV tubing, calculate the flow rate in drops per minute. All right. So, a drop factor, because this one didn't give us a drop factor. It just says use pediatric micro IV tubing. So you got a micro drip set, and then you've got macro drip set. This is going to be how many drops in the little squeeze part, the chamber that you see on the IV pump set. How many drops does it take to infuse 1 milliliter of fluid? So there are several calibrated sets for macro drips, because if you got 10 big old juicy fat drips, that's a big macro size drip, right? This says micro drip, so we need little itty bitty little ones. That's what you will usually use for like the peas and the babies, right? Because you can't give them a whole lot of fluids fast. So a micro drip is always going to be 60 drops per milliliter. Okay, so our goal is to find, again, drops per minute. So it gives us a rate of 84 milliliters per hour. Okay, and then it says that we're going to use our pediatric micro drip, which is 60 drops per milliliter. So if I'm looking for my drops, I'm going to use this puzzle piece first. So 60 GTT per ml. Okay, I got milliliters on the bottom. I'm going to put my milliliters on the top, which is that. Milliliters crosses out. And then we're going to do 1 hour is 60 minutes, because we want our puzzle down here to match up here. And we got drops on the top and minutes on the bottom. Okay. Boom, boom. And there you go. So we'll do 60 times 84 divided by 60. So anytime you see a micro drip set and it gives you the milliliter per hour, the 60 on the bottom is going to cross out with the 60 on the top. So it's automatically going to be 84 drops per minute. Did you see that? Do you see that connection? I like connections. All right, hold on. What you look like? Okay, can you take the shirt out? Okay, then. Pull your shirt out a little bit. Okay. All right, hold on, y'all. Let my kid out. Let nobody tell you to talk to my live folks. All right, you look cute. Okay. You gone? Yeah. All right. Oh, gosh. What? Is your ankle ashy? No. Okay. Where your dad? Okay, then. What time you bringing her back? You know she got recital in the morning. All right, dear. Whew. Jesus. Okay. All right. I'm back. Can you do the desire over half? Trying to. No, you didn't come in here and cuss. Jazzy, I know you did come up here and say cuss word, cuss word, cuss word. No, I'm just kidding. Y'all know I really favor dimensional analysis, but no, if you like desired over half and that's how you understand it, then I'm not gonna shun it. I love dimensional analysis. Me too. I hated it in school though, so that's why I'm not gonna even be a hypocrite and say, oh, dimensional analysis was the way that I did. I didn't. I used to like ratio and proportion, and like I was good at math, so this I liked doing like I'll times it by this and then I'll divide it by this and this because it made sense to me. But if it don't make sense to you and you can line up some puzzle pieces and make your Beauty and the Beast, then what it is what it is. But yes, so there is a formula, and that's the thing with desired over have or like other ways. You have to remember formulas, and it has to be the exact same way that you do it. Oh, excuse me, you guys. All right, I love dimensional analysis, but I watched the oh my gosh. So I did. That was a me, but I was just trying to see. You know what? Trying to be nice and trying to show you different ways. I don't put some little in the atmosphere. Okay. So anywho, formulas are going to you have to follow them like exactly how they are. So that's the tricky thing about it is it's concrete and you just put the numbers in there, but you have to have it the right way. So it's your volume, which is going to be in milliliters, over, I don't like how I wrote that you, but whatever, over your time, but the time has to be in minutes. This right here, this right here has to be in minutes, or you're going to get it wrong. So you have to remember that part, times your drop factor, which is going to be drops per milliliter. And you'll see that the milliliters cross out, so that's when you get drops per minute. So in this case, it is 84 milliliters over 60 minutes times 60 drops per ml. Okay? And so the milliliters crosses out, and that's drops per minute. So if you can, and if you have space in your brain, out of all the other stuff that you're trying to get through in school to remember a formula, that's how you would do this one. But like I said, if you're not good at math, or if you can't remember that, or you just don't like this way, you like the other way that I did it, which is my favorite, then I also like dimensional analysis because you do it every single problem the same way. You can do it the same way. You don't have to change it up and learn little, okay, well, if it's a drop factor, I have to learn this. Or if it's a weight-based problem, I have to learn this. You find your goal, you get your puzzle pieces, you line up your stuff, and then you multiply and divide. And that's it. All right. So, boom. Staphycillin. 4 grams in 100 mLs of normal saline going over 4 hours. The drop factor is 15 drops per milliliter. And we need to find drops per minute, right? So our goal is going to be drops on the top and minutes on the bottom. So listen, how do we know what is fluff and what do we use in the problem? So is this problem asking you for a gram? Is it asking you for a microgram? Is it asking you for a milligram? Is it asking you for a unit? Is it asking you for a milli equivalent? It's not asking you for any of the mass measures, right? It's asking you for volume over time. So how much over how long? So this right here is going to be your fluff. You will kill yourself trying to figure out, how do I include this 4 grams in this problem? You don't. It's fluff, okay? So that's how you use what your goal is to determine what the fluff is. If it's asking you for this and this and this and this, that's what you give it. If it's not asking you for that, then leave it out. That's how you can kind of steer towards, okay, what is fluff and what is not. Lord, not me trying to calculate the fluff. You see what I'm saying? Exactly. It's fluff, and they know it. And you know, I've been trying to fluff up my problems more, so you can get practice and get used to seeing it, right? So we need our volume, which is 100 milliliters, and it really literally tells you over 4 hours. So 100 mLs over 4 hours, right? And your drop factor is 15 drops per ml. So we're looking for drops. We'll do 15 drops per milliliter times 100 milliliters over 4 hours. Milliliters crosses out. You got drops on the top and hours on the bottom. Oh, no, 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 no. We've got to continue on. We've got to do 1 hour is 60 minutes. So our hours crosses out, and we got drops on the top and minutes on the bottom. So we'll do 15 times 100 divided by 4 divided by 60. And that's going to give us 6.25. Is that what you got? Hold on. 15 times 100 divided by 4 divided by 60. Yeah, 6.25. How'd you get 21? 100 milliliters an hour is going to be over 4 hours. Yeah. So we did, what's 100? What's up? Huh? Yeah, that's fine. All right. Fix your hair. Did I miss the zero? 100. So we did 15 times 100, because it's 100 over 4, right? Divided by 4 hours divided by 60. 6.25. You missed the zero. Oh, okay. Look, I always be like, okay, wait a minute. Now, sometimes I go a little fast. So, yeah. So, let's do something like the IV infusion time. So, we did a couple of practice ones where we had to convert the time and the minutes. So this is where it is where you can use your time and your minute conversions. So calculate the IV infusion times of an IV with a total of 100 mLs left in the bag running at 25 milliliters an hour. What is the infusion time? And answer in hours and minutes. Okay, so we are going to be looking for a goal of hours, because when we look for hours, our whole number is going to be the amount of hours, and then the number behind the decimal is going to be our minutes. So it says that we have 180 mLs going at 25 milliliters per hour. So I'll write my puzzle pieces so I can see what I need to choose from. If I'm looking for hours, I'm going to start with hours. So that's this puzzle piece. Put hour over 25 milliliters. All right, 180 mLs over 1. Cross it out, and now you're left with what you're looking for, which is your hours. So then we'll do 180 divided by 25, which is 7.2 hours, right? So remember, this part is your hour part. This part is your minute part. So we'll do 0.2 times 60, and that's what's going to give us our minutes. So it'll be 12 minutes, right? So 7 hours and 12 minutes. How y'all like that one? Face is itching. Need to go moisturize. Makes sense? Makes dollars? Makes sense. All right. Oh, man. Let's see. They said it's going to be a whole nother like 2 weeks before our computer system come back. Well, maybe 4 to 6 weeks. That's what I've heard. I don't know. This is wild. Wow. The doctor orders a 500 milliliter bag of IV normal saline to be infused at 20 drops per minute. The drop factor is 10 drops per ml. You start the IV infusion at 5 o'clock in the morning. And at what time will the infusion be complete? So this one, we're going to need to figure out how long is it going to take us to do the infusion, and then what time is that going to be? On your gram, you said you're trying to change a gram to a milligram. Yeah, you got caught up in the fluff. That's why I was like, what is it asking you for? Is it asking for a gram? Is it asking for a milligram? It ain't asking for none of that stuff. So that's just up there taking your time. All right, so we're looking for hours, right? And we know we have a 500 ml bag. It's going at 20 drops per minute. and the drop factor is 10 drops per milliliter, okay? And so if we're looking for hours, we're going to start with hours. But do we have hours available? Nope. But I'm still going to start with what it is that I'm looking for. I do it the same way every single time because I can use a conversion. So I know that 1 hour is 60 minutes, okay? So then now I can use my puzzle piece with my minutes in it, and I'm going to flip it. I'm going to put my minutes on the top and my 20 drops at the bottom. My minutes crosses out. Now I got drops on the bottom. I need drops on the top. So boom, 10 drops per ml. Your drops crosses out, and now you got mLs on the bottom. I can use my 500 ml puzzle piece right there, and it's over 1. It's just by itself. And guess what? Everything has crossed out except for what it is that we're looking for. Are you getting the rhythm of it, the feel of it for doing dimensional analysis? No. I need to actually pull one. I'll pull one actually since you're here. Hey. Okay, yes, my pre-nursing student. I'm glad. So when you get into dosage calculations, you're going to be up here rocking it. They're going to be like, girl, how did you do this? And you're going to be like, Nurse C taught me. No, I'm just kidding. But seriously, I'm glad that you're getting the hang of it, right? So hours and minutes, all right? So we need to know how long this is because we know it's 4 hours and some change, but how many minutes is it? 0.16 times 60 equals 9.6. So 10 minutes. We're going to round it to, right? So that's 4 hours and 10 minutes, right? If you start at 0,500 and we add the 2 times together, this side is your minutes, this side is your hours, right? This is going to be 10, and that's going to be 9. So our end time is 9:10. Boom. She said, thank God. Oh, my big sister on TikTok. Yes. Yes. Oh, buddy bop. Let me look at this, what you sent. Let me see if I can pull up a cool question to do. And give an example of... How y'all feeling about this? Like, is the breakdown kind of making sense? You know? Because, I want to make sense. I not just want to be talking like, oh, you got to cross your units out and puzzle pieces and relationships and wood. You like, what the heck is she talking about? Like, no, I want to make sense. I want it to make sense. All right. So let's look at one that was submitted. And I need a clean sheet. Boom. All right, so let's look. So the question asked me, it says we have an order and it's for a drug, 60 milligrams. That's IM, which is intramuscular, every 6 hours. So Q6H, right? So this means that there is one dose that is 60 milligrams. You're going to give it in the muscle every 6 hours. All right. So this part is called your frequency. This is how often you give one dose. That is really used for how much you would give in a day if that asks you that. Okay. So the second part says that we are supplied the medicine and it is a 50 milligram per milliliter concentration. And then our question is, how many mLs would you administer per dose, and how many mLs would you administer per day? So it's a 2-part question. So listen, We're gonna do this one question at a time. So I don't like that word an L. I mean an S after emails because it's like already kind of plural. I don't know. Nitpicking. Sorry. ML. All right. Per dose. So the first part, let's do the first part, which is going to be how many milliliters we would give in a dose. Okay, so let's look at our puzzle pieces. We got 60 milligrams. That is one dose that you would give 60 milligrams. Okay, we know that this part is the frequency. That's how often you would give one dose. So if you did 24 hours in a day, right, and you gave something every 6 hours, so that's dividing that day up by 6, right? So that means you would give 4 doses in one day, right? 4 doses in one day. We've got our prescription, our medicine that is 50 milligrams per milliliter, and we want to know how many milliliters per dose in the first part, right? So if we need milliliters on the top and dose on the bottom, I'm going to use this puzzle piece right here. So it's got my milliliters in it. I'm going to flip it upside down and do milliliters on the top, milligrams on the bottom. So now I've got milligrams on the bottom and I need milligrams to go on the top to cancel it out. So I'll use this puzzle piece right here. So 60 milligrams per one dose. All right, milligrams crosses out, and now you're left with how many milliliters on the top and dose on the bottom. So once you get to what your goal is, don't keep going and just putting stuff and crossing it out for just the sake of putting stuff and crossing it out. We want what our puzzle is that we putting together to look like on the box, that Beauty and the Beast picture, right? So boom, we're at the picture. So now we're gonna do 60 divided by 50, which is going to be 1.2 mLs per dose. Okay, so now on to the second part. Excuse me. We need to know how many milliliters per day. Okay, so if we have, okay, I'm gonna write my puzzle pieces again so that we can see it. Okay, so we got 4 doses in one day, and we got that from the frequency because it says we give it every 6 hours. So 24 divided by 6 is going to be 4. So then we've got 60 milligrams is in one dose, and then we know that our medicine comes in a 50 milligram per milliliter concentration, and our goal is milliliters per day. We want milliliters on the top and day on the bottom. So I'm going to start with my milliliters again, my puzzle piece that has the milliliters in it. So ml over 50 milligrams, okay? And then we'll do 60 milligrams in one dose. That crosses out. And then we'll do 4 doses is in one day. And that crosses out. And now we have milliliters per day. You see how we did that? So now we'll do 60 times 4 divided by 50. And that's going to be 4.8 milliliters in one day. And you can double check it because in the last part we said that it is 1.2 milliliters per dose, and we determined that there are 4 doses in a day. So 1.2 times 4 is what? 4.8. I'm finna let the dog out. Y'all can discuss among yourselves how we just smoothly did that. I'll be right back. Be quiet, sunshine. I'm letting you out. Okay, that was smooth as a hot comb on nappy hair. Oh my gosh, my pre-nursing brain is mind blown. It could all be so simple, but we rather make it hard. Yes. So that is why I love dimensional analysis. Love it. Love it, love it, love it, love it, love it. Love it, love it. Okay? So, yeah. I've got to go, would have never gotten the 4 per day. Yes, so that is what's called the frequency. The frequency is how many times you have a dose that's in a day, right? Okay. So, yeah. So if you have received an order for medicine that has, let's see, have 500 mgs over 15 minutes, the directions say to dilute it 1,000 milligrams in 50 milliliters of 0.9% normal saline, right? How many milliliters per hour would you program the pump for? Okay. So if you've got an order for 500 milligrams to go over 15 minutes, because remember, we got our puzzle pieces, right? Our relationships. And then this says we're going to make it 1,000 milligrams in 50 ml. We want to get on the top milliliter and on the bottom hour. So if I'm starting with my milliliters, I'm going to use this piece right here. So 50 milliliters over 1,000 milligrams, okay? And then it says milligrams on the bottom. We need milligrams on the top. So we'll do 500 milligrams in 15 minutes, all right? Milligrams crosses out. We've got minutes on the bottom. We need minutes on the top to cross it out, right? So 60 minutes is in 1 hour. Minutes crosses out, you have milliliter per hour. Just smooth as it wants to be. Y'all remember like getting your hair combed back in the day when you had to hold your ears so you wouldn't get it burnt? You're like, ooh, yeah. And then like it come out all smooth once you hit the hot comb on there. That's how smooth we just did this problem. Just like that. Just like that, y'all. Like that, y'all. Like that. What Mariah said, these chickens is ash and I'm lotion. These Dosage Calc problems is ash and we lotion. Come on. Nurses cometh all 2024 because you literally just set up a problem that you didn't know what was going on. You have 500 milligrams to go over 15 minutes. We're going to dilute it as 1,000 milligrams in 50 mLs of normal saline. How many milliliters per hour will you run it? Just set it up as what it's asking for. Milliliters on the top and hours on the bottom. If you line up your units and you cross it out, you will never go wrong. Ever in the ever of evers. 50 times 500 times 60 divided by 1,000 divided by 15. And that is going to be 100 milliliters per hour. All right. Oh, buddy. Let's say we had a problem that says there is potassium that was 120 milliequivalent. So we know that potassium has to be measured in milliequivalents, not milligrams or grams or units, right? And it's in 500 milliliters. And you infuse it at 10 milliequivalents per hour, okay? So we got to set our pump, because you will never, ever in the evers of ever push potassium, because you could kill your patient, okay? You never push potassium, IV, never, okay? So then if we want to set up our pump, we will start with milliliters per hour, right? So we got 120 MEQs per 500 milliliters, and we want 10 MEQs per hour. I'm going to start with my milliliters. So 500 mLs is going over 120 milliequivalents. I got 10 milliequivalents per hour. My milliequivalents crossed out, and I've got milliliter per hour. Boom, bam, boom. 41.6 repeating. And if this asks us to round to the nearest whole number, 42. And that's it. If you have magnesium, that's another electrolyte, right? It's going at 2 grams an hour for pregnancy. So for preeclampsia, right? And then you've got 25 grams and 500 mLs of D5W. We want to know how many milliliters per hour will you set your IV pump at, right? So what we're starting with again, 500 mLs per 25 grams. And you got 2 grams going at an hour. Your grams crosses out, you got milliliter per hour. Easy peasy, lemon squeezy. 40 mLs an hour. So, in conclusion, that's how I used to in all my papers when I was in school. In conclusion, dosage calculations does not have to be hard for you if you are not a math person. If you like solving puzzles with Beauty and the Beast on there or whoever, you can use dimensional analysis and get to where it is that you're looking for with what it is that you have in your puzzle pieces. You just set it up and cross out your units. And if you are looking for more in-depth study sessions, yeah, that is my email address right here, and that is my website that's going across down there. I also have resources that are on my site that's got step-by-step breakdown and practice problems. I'm gonna upload some more practice problems, so be looking out for those soon. And study sheets with like your cheat sheets with like your formulas and your metric conversions. So yeah, take advantage of that. Remember to go to my YouTube channel if you like this session and you want to see prior sessions that I've done. I've got a pediatric dose session on there and everything with just weights and pediatric doses. Take advantage of it, and support me as I'm trying to support you through school. So I appreciate it so much, and cool. It's appreciative to meet new people on this Friday evening. Do I have any books for beginners? I'm actually working on my e-workbook, but I'm not sure. Lisa. Chew. Maybe some of your other nursing students on here can give you a direction. But yeah, y'all let me know how I can best help you guys. I appreciate you. Like I said, thank you for your likes, your encouraging words, your compliments, your prayers. Cause as I pray for you,